I am just trying to build the background here and trying our viewers to understand that how the agency or the need or requirement of a doctor on record comes. And it is it is a very deep narrative in itself, that a patient, when he's having a certain healthcare condition, say for example, a 65-year-old lady having varicose veins. We know varicose veins is something, when the veins are protruded, and it leads to a lot of pain on walking, and often found in elderly population. And how now, how the patient is going to approach the healthcare problem, how he's going to reach the doctor. So this mind map, this flowchart diagram, which if we understand, we can delve deeper into the doctor on record concept. And a doctor on record, if I say, is a person, a professional who is committed to the patient's care right from the point of contact, when the first point of contact is there, when the patient is hitting the clinic of the doctor, the diagnosis is being made, a provisional diagnosis, a differential diagnosis, and a final diagnosis. In our AIMS pedagogy, we really lay a lot of emphasis on the differential diagnosis even. So reaching the diagnosis is in itself a very critical part of the entire healthcare delivery, because we say well diagnosed is half the cure done. So once the diagnosis is done, then the treatment is ongoing, is started. Now, this entire path, when the patient is reaching the doctor, that receives the treatment, then the care compliance, the care giving by the family members, and if a hospitalization or any procedure is needed, then the patient is referred to the hospital facility. So the doctor on record is one who is a nodal person, in charge, who's committed, competent, connected, and who gives end-to-end care, which we say seamless care. So even if this patient is going to the hospital and getting admitted, the doctor on record is coordinated with the various, specialists in the hospitals, the doctors, the caregivers, and the stakeholders in this path to ensure seamless healthcare delivery. Now, this is a unique concept, and which I feel like we have the legal advocate on record who advocates and fights for the plaintiff's case, and till the very last mile. That concept is something which is really needed for efficacious healthcare in our country. And doctor on record is some kind of a agency which is balancing all the various specialties, disciplines, and coordinating them and providing the holistic advice to the patient,